there's a tremendous advantage to having a primary care physician, especially with today's multiple subspecialization, to, if nothing else, really coordinate the care. It's very, very easy to have a headache and look for neurologists, and the yellow pages are now on the internet, and go see a neurologist, which is really the wrong way to provide and receive health care. It's important to see someone who has a good relationship with specialists, with the hospital, so that they can improve the quality of your care and improve the outcome, really, for less money. I can't tell you the number of times, I've saved the system money by, again, reviewing tests that have been done by specialists. Patient comes in, they forgot that it's what the specialist had done. They're asking for this and that, and you look and you go, well, you've already had that. That's negative. So, no, we're not going to get another CAT scan. We're going to try this, and I'll work with you, and I'll see you again. I had a professor once when I was in school that told me the physical exam is extemporaneous. By the time you get done taking a good history, you don't have to do an exam. And to a certain extent, that's true. It's very important to talk to the patient, know their history, know what they've been through. It makes a world of difference, obviously. Well, medicine is a learning process. You're the smartest the day you die, if you're doing your job right. And in that respect, I've learned a lot from treating Veronica in terms of a different illness, i.e. Turner syndrome. I find it really rewarding that the parents, grandparents are so much involved, and I think they've made a huge difference in that child's life as a result of their sticking to trying to help and come to a diagnosis with her, because I think it would have been very easy to say she has ADD, put her on some medication, and then just keep treating the infections with antibiotics, which would not have been a good result. So what they've done has really it's going to in the future make a huge difference in this child's life, and not the least of which is that QT syndrome business, where that needs to be watched very carefully as she matures, because you don't want her playing basketball when she's 16 and fall over on the court and is unrevivable. Sudden death syndrome. So as a result of their tireless sort of work towards explaining and figuring out what's wrong with her, they've done me a favor by introducing me and educating myself, and to the child, helping her out. Now it's interesting because now some of the specialists at Aurora are becoming educated, and it's easier to get care closer to home. This is what it comes down to, and so hopefully she won't be traveling to Cleveland once a year. She can travel to my clinic. I guess that's a lot shorter drive than Cleveland, and again, just props for the electronic medical records. I foresee in the future having all the information available, so there would be no need to travel that far.